the trial enrolled the patients, and this included patients across IMDC risk groups, comparable to what we see in practice. About 20–25% were favorable risk disease, around 60% were intermediate risk disease, and about 20% were poor risk disease. About the enrollment was evenly distributed between the US, Europe, and the rest of the world. And so I think, when we look at the data, here we are at the initial analysis, and what we see with a median study follow-up of 18 months is that there's a marked improvement in progression-free survival with a hazard ratio of 0.51. The median PFS was 16.6 months with Nivo-Cabo versus 8.3 months with sunitinib, so a doubling in the progression-free survival. And then when we look at overall survival, while the median overall survival had not yet been reached, the hazard ratio certainly favors the combination of Nivolumab and Cabozantinib with a hazard ratio of 0.6 and a p-value that's high statistically significant. And when they look at the breakdown of both these by subgroups, I think that the benefit seems to be independent of subgroups. To include, there seems to be a benefit in favorable risk disease as well as all the other subgroups.